Eosinophil is a phagocytic cells, and it is also a white blood cell granulocytes. Okay, like NEB, neutrophil, eosinophil, and basophils are granulocytes. Okay, and so it will be having a granules. So it is a phagocytic cells which having a bilobed nucleus and also having large ring granules. Now functions is two function: allergy and parasitic infection, because in parasitic infection our body will produce eosinophil and also antibodies IgE. So eosinophil is going to be important for allergy, type 1 hypersensitivity reaction, and parasitic infection. As I already explained in the last video, that histamine will invite eosinophil into an area of allergy. Okay, and then eosinophil is going to be secrete histaminase, which will break down the histamine. It will also secrete aryl sulfatase, which will break down SRSA, which is called slow reacting substance of anaphylaxis. It will also secrete heparin, which will block the thrombi and clotting factors, and any thrombus or clot which is formed as a result of histamine. As I already explained in the last video, the histamine lead to vasodilation, which lead to the increase the blood flow but decrease the blood velocity. Decrease the blood velocity means blood stasis, and that blood stasis can result into the thrombus clot or thrombus formation. Now the very important thing is related to eosinophil is it having IgE, type 1 hypersensitivity, allergic reaction, and eosinophilia. This IgE is going to coat the parasite, and this IgE is also lead to the degranulations of the mast cells and basophil, which will lead to type 1 hypersensitivity reaction. The parasitic infection like Ascaris lumbricoides and filarial like F. Ocheria or Broggi, any parasite will lead to eosinophilia and IgE type 1 hypersensitivity reaction. Now, if there is eosinophilia, it means that eosinophil count is increased. As we already know that the normal eosinophil count is 3%. If the eosinophil count is increased more than 3 or 5%, that will lead that is what we call eosinophilia. And so the causes for eosinophilia is NCAF, allergy, all allergy like type 1 hypersensitivity, allergy, Addison disease, allergic rhinitis, allergic conjunctivitis, anemia neoplasm, C mean any collagen vascular disease. All collagen vascular disease will lead to eosinophilia. Asthma, okay, and A and P is for parasite. Okay, now you see here, you see this is an Englishman, and this Englishman is wearing, okay, these two are bilobed nucleus, okay, and it having large pink red or pink granules, and he is wearing. Now if you see the English people, they have red dot or pink dot on their face. So this is how you will remember, and they are wearing something, okay, like this, to listen, to hear his songs or something, okay, to listen songs or whatever. So this Englishman having, okay, the red or pink granules, and he is wearing the cap, and from this cap, N cap, like when there is eosinophilia, just the mnemonics is N cap. A is for allergy, Addison disease, and allergic rhinitis. N is for neoplasm. C is for collagen vascular disease. A is for asthma, and P is for parasite. Okay, like, okay, this is now eosinophil is going to secrete histaminase, which will degrade histamine, aryl sulfatase, which will break down SRSA. SRSA are actually leukotriene and prostaglandin. Heparin will inhibit clot formation and major basic protein, which will kill the parasites and host cells. Okay, so these are the secretion of eosinophil, which is very important. Now let us talk about MCQs related this. Okay, we are having a 10-year-old boy who has recently migrated. When you hear migrated word in the MCQs, then you have to understand we are talking about parasitic infection. Okay, now he having a cough, and he having shortness of breath, and he also having wheezing. So cough, shortness of breath, wheezing, it somehow goes in type 1 hypersensitivity reaction. Now he stated that he also have abdominal cramps. So there is something in abdomen, and for several weeks on examination the abdomen is distended and wheeze in all lung field. From the wheeze we know that it's type 1 hypersensitivity reaction, and from distended abdomen there is parasitic infection in the abdomen. Okay, but we are not sure now about this, so we will go and look for the labs. Like TLC is 10,000, and monocyte is 7%, eosinophil is 12%, and HbS protein. Everything is okay. Now you see eosinophil is 12%. I already explained in the last video that how you will remember the first percent of the leukocytes. So never love my ex-boyfriend. N is neutrophil 60% and half of 60 will be 30, that is for L lymphocytes. M5 monocyte is 5%, eosinophil is 3%. Like you see eosinophil, you write eosinophil like this, okay, E is like this. And so we write 3 like this. So you see eosinophil is 3%, this is how you will remember. 3%, and B is basophil, B is near with A, and A is 1, so basophil is 1%. Now you see normal count of eosinophil is 3%, but here they give us eosinophil 12%. So now it's sure that it's a parasitic infection. Okay. And which parasite that is going to be which involve the abdomen, that is actually most commonly. And now you see they say which of the following reaction is most likely underlying cause of this finding. So they give us an MCQs: type 1 hypersensitivity reaction, type 2, and type 3, type 4. So the answer is type 1 hypersensitivity reaction, because this Ascaris lumbricoides is actually related with the abdominal cramps in abdomen. And second, we also having a shortness of breath, wheeze, and in all lung field we have wheezing, shortness of breath, and there is eosinophilia. So from this eosinophilia, okay, and here you see shortness of breath, cough, and wheeze, and the abdominal cramps, is now clear that it is parasitic infection. And in parasitic infection there will be type 1 hypersensitivity reaction. Okay, whenever you see any parasitic infection there will be IgE and there will be eosinophilia. IgE mediated type 1 hypersensitivity reaction and eosinophilia. If you see these both in MCQs, this is actually going to be parasitic infection, and this is going to be involved the type 1 hypersensitivity reaction. Like for the Ascaris lumbricoides, it's get mature in the intestine, and then in the intestine it's going to produce the egg and ova. Then this egg and ova is going to the larva will move out from this egg, and then it will start moving towards the lung. Okay, so lungs and abdomen, these two will be affected by Ascaris lumbricoides. Now you see this is any parasite. This parasite is going to be coated by IgE. There will be a thin layer of IgE coat around the around this parasite. But this IgE can also going to coat around the basophil and mast cells, and which will lead to basophil and mast cell degranulation, that will lead to type 1 hypersensitivity reaction. But this parasite is going to be killed now by type 2 hypersensitivity reaction, as it form the coating around this parasite. But it's okay, don't be confused with this. Okay, and so it will this IgE coated will kill this parasite, but this IgE also lead to this IgE is going to also lead to the coating of the basophil and mast cells, which will lead to mast cells and basophil degranulations. Okay, so just remember this. This is also Ascaris lumbricoid infection, can be also called this is Loeffler syndrome or vermius pneumonia. Okay, now let us talk about another MCQs. A 39-year-old male develops scrotal inflammations, itching, localized scrotal swelling, and tenderness of his lingual lymph nodes 4 months after returning from a trip to Africa. So you see here they are talking about the migration, okay, or trip. A blood smear is positive for microfilaria, and filaria, you see this is parasite. Which of the following immune mechanism? So it just give us in this. There is itching, localized scrotal swelling, itching, and everything that is related with the, and scrotal inflammation that is related with the type 1 hypersensitivity reaction. Now you see they say that a blood smear is positive for microfilaria, and so filaria is actually parasite. And so now they are giving you that which immune mechanism. So the first one is antibody binding cell or tissue causing death of the cell tissue, that is type 2. Antibody binding cell or tissue changing the function of the tissue. Okay, and then they say IgE mediated degranulation of mast cells and basophil. And so when there is parasitic infection, there will be increase in IgE and eosinophil. This IgE will also coat the parasite, but this IgE can also mediate the degranulation of mast cells and basophil. So the answer is this. Okay, so hope you will remember it now.